Good afternoon, everyone. Thank you for joining me for our MyHealthPlan demonstration. My name is Eric Pearson. I work in agent relations here in our Fort Myers, Florida office at Jack Schrader and Associates. Today, I'm going to be bringing you through MyHealthPlan. It's one of two online enrollment platforms that we provide to our agents and agency partners free of cost. Once you're logged into the Agent Resource Center, I want to point out right here on the MyHealthPlan page, we do have the MyHealthPlan quick guides. So if you have any questions on the ancillary products, how to send an how to complete an HRA, how to follow through with the call recording, the CMS disclaimer, all of that is available right here as PDF files on the MyHealthPlan page. We also have a demonstration video available for you to watch at your convenience. And then right below that, we have some pull-out videos that go through just how to create a client profile, how to do the call recording, scope of appointment, and a few other quick videos. To log into MyHealthPlan, you'll just simply click on Login. That will bring you right to the 2024 dashboard. The 2023 and 2024 MyHealthPlans have been combined into a single platform this year. You will be able to toggle between each plan year on the plans page. Our dashboard page, we first have access to reports. Reports is where you can come in and run a report on enrollments that you've entered into the system in the last 31 days or less. We also have more agent training materials available here, both in PDF format and in video. So if you're looking for more details on a specific section of MyHealthPlan, definitely refer here to the agent training materials. On our dashboard page, when you send an enrollment or a quote or a scope of appointment, they will get listed here when you create a task. These tasks help remind you to follow up on those enrollments or quotes or scope of appointments with your client. Check off a task that you've previously created. We can simply just check the checkbox and it will complete it for us. It also does give us instant access to the client profile that task is associated with. Medicare.gov connection. If your client has already set up and entered in their prescription drugs on a Medicare.gov account, you could send your client an email. In that email, they'll have instructions on how to sync their Medicare.gov connection with their MyHealthPlan profile, and it would automatically import their prescription drug list. But again, the client does need to have a Medicare.gov connection already. And these are any random tasks that you create for yourself on the client profile that you then need to follow up on. At the top of the page, I want to first bring our attention to the drop-down arrow next to your name in the top right corner. When you click on this drop-down arrow, we can access the reports, another way to access agent training materials, and the account overview. The account overview is your profile. Once you enter the account overview, we have our personal URL or PURL, which is your shopping link. We have access to both the 2023 shopping link and the 2024 shopping link. When you copy this shopping link and paste it into either your email, website, browser, your Facebook, any social media, it allows someone who clicks on that, they will see your name and your contact information here. They will be able to enter in their zip code and view any Medicare Advantage, prescription drug, or standalone PDP plans that you are licensed and appointed to sell in that zip code. And they will be able to self-enroll themselves. And you will get credit for that piece of business. So again, that is the personal URL. And again, on the personal URL, we see that we have our logo and our contact information. That logo and contact information is pulled from your account overview. So by uploading your logo or headshot, it will automatically end up on any quotes, scope of appointments, or personal URL that you send to your client. It really helps with your branding to add a photo. This information will just be your personal information. If you need any of this updated, you can reach out to us here at JSA. Down here at the very bottom, this is where you will see your active selling permissions. Because this is a test account, I do not have a list of carriers, but right here you would see Aetna, Humana, United Healthcare, WellCare, all the different carriers that are supported on MyHealthPlan, along with the plan type, so an MAPD, MedSup, ancillary, the year, and the writing number. So if you think that you're not seeing a specific plan on the plans page that you are licensed and appointed to sell, definitely come back here to your account overview and check your permissions. Again, if you do not see a permission that should be added, reach out to us here at JSA and we will be able to assist you with getting that permission added for you. Again, keep in mind that permissions are only added once you are ready to sell with that specific carrier in that specific state. So if you need to add a state appointment, you can also reach out to us here at JSA. I'm going to go ahead and bring us back to our dashboard. Now, if we already have a client entered into the system, the search is the same as it has been in years past. We simply just click on Search Beneficiary. Again, keep in mind that the list that it's searching is only your current client list that you have entered onto the platform. So you only really need to enter in the first name or last name and click Search. The less information makes it more convenient. To add a new profile, we just click on New Profile. Once we're on our new profile page, we just start at the top and work our way down. We'll start with our zip code, first name, last name, date of birth, email address, and we want to make sure that if you're going to be texting a scope of appointment or texting an enrollment or any quotes, that the number you enter in is a number that can receive a text and browse the browser on the phone, because you do have to have a smartphone to complete a scope of appointment or an enrollment on text. Once we get their information entered there, we go ahead and move on to the address. And it is a smart system, so as soon as you start typing, it will automatically search that address for you. Right here under sales information, if the client has a power of attorney or someone who is authorized to, on their behalf, sign the enrollment or scope of appointment, you would enter their information here. Additional information, this is where you can enter in anything you would like to store on the profile. Only you as the agent have access to these custom fields 1 through 5. So often I recommend putting in where you met them. You could put in their doctor's name, anything you would like to store on that profile. Be sure to always click Save Once you click Save, that profile has been created under your account. We can now enter in their Medicare ID. We can enter in their Part A and Part B effective dates. And once we enter in their Part A and Part B effective dates, we can check their Medicare eligibility. Now keep in mind, the system is set up to only check eligibility once every 24 hours per profile. So once you check that eligibility, you will not be able to go back and check it again for 24 hours on that individual client. So we can see success, meaning yes, they are Medicare eligible. And we can also see they may be eligible for DSNP. To check their state Medicaid eligibility, we would enter in their Medicaid ID here and check their state Medicaid eligibility. That would then give us their QMB or their Medicaid status and level. Any quotes we send would show here, and any enrollments we submit on this client will show here at the bottom. Once we've entered all this information in on the profile, we want to continue to the scope of appointment. I can now choose to email that scope of appointment or text that scope of appointment. I'm going to go ahead and email it. It will then populate right above, letting me know that it was emailed, and it automatically prompts me to create a task to follow up on that scope of appointment. I can adjust the due date of that scope and add that task. On the scope of appointment page, we can also complete a scope of appointment form in person when you're meeting with the client face-to-face. We can complete the SOA form by phone by utilizing our call recording feature. We can print a blank scope of appointment and then upload it to the profile after. Once the client receives that scope of appointment in their email, it will look just like this. It will say, "Hi Wayne, I'm looking forward to meeting with you. Please fill out the scope of appointment online form. Be sure to select the Medicare Health Plan options that you are interested in discussing during our visit." They will simply click on Complete Scope of Appointment form. That will then open up that scope of appointment form on their browser. There is a video here they can watch. It is optional. It explains exactly why CMS requires agents to document the scope when marketing products. As always, we advise you to advise your clients to check all the boxes on the scope so you're not limited in what products you can discuss. It will automatically fill in the client's information for them based on what you entered in on the profile page. And again, if they have a power of attorney or an authorized representative, that person can enter their information here. The client will then check the box that they acknowledge and understand the scope of appointment form and submit the form. Once that's submitted, they get a thank you page. You can then come back to your scope of appointment page and refresh. Once you refresh that page, we can see our client completed that scope, the products that they checked, and you as the agent can now complete your portion of the form. You'll put your information in here, your initial method of contact, and if any information is not correct or missing, as you see, it will flag you. And all required information has a red asterisk next to it. What plans? You'll check the box. You'll use your mouse to sign the form and then submit it. Once that form is submitted, your scope of appointment is completed and you can view a PDF by clicking on View. If you're an agent that likes to download for your own records, this will download a scope of appointment form for you. The platform will store this for 10 years. So if you do need to come back to it, you can come back to the client's profile. Now that we have our scope of appointment form signed, I'm going to go ahead and call our client. And we're just going to simply click on Start Call Recording. It is going to bring up the client's phone number. Call your client, you click on the Call Beneficiary button. That will then ring your client. Your client will answer. Your client will press 1 to accept. And our call is now in progress. We now have the call recording activated, and we can click Continue. Once we activate that call, we do want to read the disclaimer to our client. And again, our disclaimer is available right here on the Agent Resource Center. Once that call recording is activated again, you do need to read the disclaimer. We do not offer every plan available in your area. Currently, we represent X amount of organizations, which offer X number of plans in your area. Please contact Medicare.gov, 1-800-MEDICARE, or your local state health insurance CHIP to get information on all of your options. Once you have read that disclaimer, we can then continue forward to our plans. And as you can see, the call recording is in progress the entire time, right here. We can then go through our plans, find the best plan that is for your client. Now, once you have your client on the phone, it's best to come in and add your preferences. Getting started adding your preferences, these are optional. You can choose whether or not you're searching for medical only, prescription drug, or medical and prescription drug. I'm going to leave these blank for the demonstration and just continue forward. Our health, when working with an MAPD, we know there's out-of-pocket costs involved. This will help your client get an idea of how much out-of-pocket costs they can expect from a specific plan. So for instance, if you leave it generally healthy, 65 to 69, the out-of-pocket costs will be generally low. If you'd like to estimate the medical costs, you can click on Yes. You can then add in how many ambulance services, chiropractic services, various visits to the doctor your client may have throughout the year. And we can update those answers just by clicking on Update. We could add in to ambulance, for doctor visits, for specialty visits, pre-emergencies, and click Save. This will then assist us in showing the client what their out-of-pocket costs may be or estimated at. And I'll go through that a little more when I get to the plans page. We can then come over to our providers. Now, these are smart fields again, So we can just start searching for a doctor, type in their name. It will then bring up the map of the area. We can zoom in and out of this map by clicking on the plus and negative sign in the bottom right. Every time we zoom in and out, we want to click on search this area right here at the top to repopulate that search area. So anytime you click and drag that map around, just remember to click on search this area. Go ahead and zoom out and search. And we'll look for our doctor, Dr. Lamar Bailey. Go ahead and add that. It'll automatically populate multiple locations if the doctor does have multiple locations. It'll allow you to choose that location and add that provider. We can then come up to the top. Search for another provider. We can click on Add Provider. Again, we get their multiple locations. Choose that location and add. If you need to change that location with the client, we can click on Edit. That allows us to edit that listing and update it. Or if we need to remove one, we simply just click on the black X and that doctor is gone. To add it back, we can just come back to the list and add the doctor back. We then continue forward to our prescriptions page. Again, it is a smart field. Simply just start typing the name of the prescription. It'll populate down below. We will choose our dose, our quantity, and our frequency. Now remember, keep in mind, if you're doing a 3-month supply, your quantity would be multiplied by 3. So if they do 30 pills per month, 3-month supply would be 90 pills. If you would like to choose the generic, we can do that here and click Add. It will populate right down below. Just like the provider page, we can click on Edit to edit that prescription, or click on the X to remove it. Go ahead and add another one. This one is a little different, so we can select the dose, the quantity, and the frequency, and this one also has a package type. If you'd like to choose the generic, we can do that here and click Add. Again, just start typing the name of the prescription. It'll auto-populate for you down below and click Add. If you need to edit any, you can click here on Edit. Or to remove one, you just click the black X. If your client already had the MyMedicare.gov account set up, this is where you could send them the email to import that information from their MyMedicare.gov account. We'll go ahead and continue forward to the pharmacies. Again, our map, we can zoom in and out by clicking on the plus and minus. We can also click on the map itself and drag it around. Once we do move it around, we do need to click on search this area right here at the top. To add a pharmacy, we just simply click on Add Pharmacy. They will then populate down here below. A new feature for 2024 is we can run formulary on digital pharmacies, such as Amazon, Infinity, US Med. If you'd like to run a formulary on the digital pharmacy, you just click on Add Pharmacy. We'll go ahead and add Amazon. And those are all down here listed below. We can then choose which one we would like as the primary or the default. And click Continue. And this whole time we're going through this with our client, in the call is being recorded right here at the top. If at any time your internet connection gets interrupted or your client's call gets dropped, all you have to do is simply click on Start Call Recording and start the call again. It will then store the multiple recordings onto the client's profile. Please keep in mind that the recordings are stored for 10 years and are only accessible when requested from a carrier or from CMS due to an investigation. We do not have access to the recordings here at JSA, and you as the agent do not have access to the recordings. If you need a copy of the recording, reach out to us here at JSA, and we can then instruct you how to file the correct request to get that recording. Once we're on our plans page, we can see we have at the very top how many plans are available in that zip code for 2024. We can then have the option here to edit if we want to see the 2023 plan year. We can click continue and it'll bring us to the 2023 plan. Again, this year, we have add non-licensed plans. So if you need to see all the plans available in a certain zip code, not just the ones you're licensed and appointed to sell through JSA, you can add those by clicking here. A new feature for 2024, and this is to help you complete that CMS disclosure. This will list you are licensed to sell 8 Medicare organizations with 58 plans for 2024. Keep in mind, those are only the carriers that you are licensed and appointed to sell on the platform. So if there are carriers that are not available on the platform that you also market and sell, just remember to add those numbers to these numbers for your disclaimer. We can then scroll down. Right here at the top, we can click this plus symbol and it'll add any special needs plans, D-SNPs or chronic. We can sort by plan premium, total estimated cost, estimated drug costs, star rating, plan name, deductible or max out of pocket. Over here on the left, we can see right now, all of our plan costs are based on the Amazon pharmacy. If we want to see these costs change, we can simply click on the CVS, and it will give us our cost change. For this WellCare Dual Access D-SNP, CVS is not a covered pharmacy, so it automatically tells us that right here. It also tells us how many of our providers we entered in are in network and how many of the prescriptions we entered in are on the formulary, along with our total estimated cost and any additional benefits that come along with that plan. Over here on the left, we can filter it by your providers, by the medical deductibles, max out of pocket, premium amounts, any add-on coverage such as dental and vision. If you want to bring up only the Part B give back plans, you can check Part B. For only plans that have an additional transportation benefit, we can add that and it will filter out the plans based on that filter. Want to filter out just certain carriers, we can simply click on that carrier name and it will only populate that carrier's plan. And same with plan subtypes. Again, if you want to see special needs plans, you can also add them by checking this box here. Over here on the left, we can go in and edit any of that information we entered in for the pharmacies, the prescriptions providers, the health question, and the get started. And all the plans are listed down below. To compare two plans side by side, we check the Add to Compare box. We then, once we have the plans we want to compare, we can click on Compare Now. This will open up another page that will show these two plans side by side. and it will highlight the plan differences in the tan color. We can then scroll down and it will automatically point out the differences between our two plans. We can see all the details of those plans along with the provider information and pharmacy and prescription information. To go back to our plans page, we can click on Previous. We can then scroll down and uncheck our Compare Now boxes. And we can create a quote. To create a quote, we simply add the quote. Once those are added to the quote, they do populate right up here at the top. We can then choose to send that quote to our client via email or text. We can choose which pharmacy we want those costs to be based on in that quote. Keep in mind when sending the quote to the client will have the availability to add it to the cart and check themselves out through a self-enrollment. So whenever you send a quote, the client will be able to check themselves out through a self-enrollment. All of our plans, we simply just click on the tab at the top to switch between the different plan types. The Medicare supplement plans do require you to complete a little more information on that client in order to get those prices or policy fees to pop up. But once you complete that Medicare supplement information, it will populate those MedSup prices for you. If you log in and you see 0 on the MedSup, just remember you need to click over there and complete the edit your answers. We then have some ancillary products available. Once you've gone through the plans with your client, clicking on plan details will give us all the information we need on that specific plan. So with your client on the phone, we can then, for this demonstration, we'll go in and do a Medicare Advantage plan. That includes both prescription drug and medical. The nice thing about MyHealthPlan is it gives you all the information on the plan you need to share with your client during that call recording. So you spent time with your client, you've gone through the plans, you've looked at the compares, you've emailed them the compares or the quotes. Anytime you need to email something to your client, you can always come up here and click on Print. And you can always, rather than choose a printer, you can save it as a PDF to your computer, and then you can always share that page with your client. So for this demonstration, we're going to come in and we're going to do a Medicare Advantage. I'm going to get rid of this quote just by simply clicking on the X. We're going to come in and we are going to do the Aetna Medicare Smart Fit plan. We can click on the plan details. We can then see the plan premium, any drug costs that are estimated for the client, any medical deductible, any medical out-of-network deductibles. This is all the information we can read out loud to the client during the call. As we scroll down past the plan details, we can get into our prescription drug coverage. We then get to plan documents. So if you're looking for a quick way to find a summary of benefits, evidence of coverage, some of the carriers will provide an enrollment form right here in the plan details. Utilize MyHealthPlan as a quick way to come in and find plan details and plan information on any plan, even if you're not utilizing the platform for an enrollment at that time. Because once you click on Summary of Benefits, it'll open up that right into a PDF for you. You can always print it or save it. We then get down to our provider information. Another new feature for 2024 is by clicking on the carrier provider directory, it will bring you right over to the Aetna or that carrier specific provider search tool. Clicking on internal provider directory will open up a new page for 2024. This page will then automatically bring up the plan that we're in. It will search for any providers in that zip code that are in network. So you can simply just click on out. You can click search. We can click Dr. Smith. And it's only going to bring up Dr. Smiths that are in network for that plan. Again, this new search tool, available in the plan details under internal provider directory. Right now, almost all the carriers do bring you to this new page. Some are still being loaded, but they are all expected to be loaded in by the 15th. So again, by being in the plan details and scrolling down, internal provider directory now shows you exactly what doctors are in network in that specific zip code for this specific plan. We can also then search prescriptions and pharmacies, and it will automatically bring up the ones in green that are considered preferred in network. We can then scroll down and we can see both of our providers, unfortunately, are out of network. We can see our prescriptions are not covered by this plan, and whether or not our pharmacies are in network with standard pricing. Over here on the right, we can always choose to change between the different pharmacies. That way we can see the coverage of our prescriptions change along with that. If your client is ready to check out and wants this, we can go ahead and then go over to our prescriptions tab. This will tell us what tiers the prescription is in. This is tier 1, tier 2, tier 3, tier 4, and tier 5, along with our non-covered prescriptions. Another new feature for 2024 is to view possible alternatives. This will then help us talk to the client about a drug that may be covered by that plan. We can then go back to our plan. A lot of the prescriptions will have this little footnote number. I want to point out the footnotes are listed right here down below. So if you're wondering maybe why a specific drug costs a certain amount or seems less expensive than it should be, it'll have a footnote that will then refer you down below that'll explain that to you. Under the frequently asked questions, we can then bring our clients through the difference between the different phases. We have our deductible phase with its description, before the gap description, during the gap, after the gap. Also, we can go into the quantity limits or pre-authorization, any details that we may need to convey to our client regarding the prescriptions that are entered onto their profile. Our health costs, this is where we entered in that information to start with at the beginning. Based on this Aetna Medicare Smart Fit plan, the estimated out-of-pocket cost for ambulance services for the client would be $550 per year. Estimated cost for chiropractic would be $15. And this is all based on the number of visits or uses we entered in on the client's profile, compared to the Aetna Medicare SmartFit out-of-pocket cost. So for this client, the estimated out-of-pocket medical cost is $1,068 for the year, based on the information we entered. We can then see this plan has a $550 in-network out-of-pocket max. Over on total estimated costs, we can see we have our premium cost, our drug cost, and our estimated health cost. This again gives us a total estimated cost of $429. It breaks the prescriptions down per cost, and then it extends out the full year for each month. To expand the month, we simply just click on these little black arrows next to the dollar amount. Once your clients decided that this is the plan that's best for them, we can simply click on Add to Cart. We have two options in the cart. We can send a beneficiary to sign and submit, or we can complete and submit for myself. If you're meeting with the client in person, you will complete and submit for myself. If you're sending the client an electronic enrollment for them to complete over email or text, you will choose Send a Beneficiary to sign and submit. We'll then choose Continue to apply. We will then complete the enrollment form right here embedded into the platform on our page. The first thing we see is a special enrollment period. So we choose what enrollment period we're utilizing for this enrollment. Our requested effective date. We'll automatically fill in this information based on the profile you created. We do need to choose the gender. We can choose whether or not this is a mobile number. Confirm the address is correct. And again, this is all happening while this call is in progress. If they have a different address they would like the correspondence sent to, you can choose that here. If you're working with an HMO, be sure you enter in that primary care physician's information here. If you need, again, to find a physician, you can choose Find a Physician. It will open up the Aetna's physician search tool. If you are a current patient, you can choose Yes and Continue. These will have all the same questions that you get on a paper enrollment form. So you'll go through, you'll ask them if they'll have any other prescription drug coverage. These questions are optional for demographic information. For the demonstration, I choose not to answer. If they're enrolled in the state Medicaid program, you could choose that here. If they would like to receive their items in the mail in a different language, you can choose the option here. Or if they would like a more accessible format, such as large print, audio CD, or Braille, that can be chosen here. And we can continue forward. We will then enter in their Medicare information. When completing the enrollment on MyHealthPlan, you will want to choose I want to pay by invoice when sending it to your client. Your client can then set up the EFT once their plan is approved with the carrier. We'll go ahead and click Continue. We can then review all the information we have entered in. by simply clicking on the little black down arrow. Once we confirm all that information is correct, we can then choose I am or am helping the person enrolling. Check the box I understand, and send a beneficiary. Again, you will choose the option I am the person enrolling and check the box. Once we send this to the beneficiary, these questions are going to reset and your client will also need to answer them. When sending the enrollment, we can choose to either email it or text it. We can then include a summary of benefits. We could include an evidence of coverage, formulary, star ratings, anything you want to send to that client will come in a form of a link. So it won't actually attach a bunch of PDFs to that email. It'll provide them a link to click on to access that information. So we're going to go ahead and click Send Application. That application has now been sent to the client. We can then create a task for the client, so we follow up on that application. Simply click Add Task and Close. Once that is sent to the client, we could come back up to the top and go back to the client's profile. Your client will receive 2 emails. One email will have an authorization code that your client will need to enter onto the enrollment email. And this is for their protection. It's just to separate it out because that does have their Medicaid, Medicare number, date of birth, address on it. So you also have access to this code on the client profile under the enrollment history. Under more details, once your client receives that email, they click on View Application. This is where they have the access to the summary of benefits, evidence of coverage, any of those documents that you included on that enrollment email. Once they click the View Application, they will be prompted to enter in that code. They'll enter in that code and click Continue. I want to point out just one more time, when you're on your agent profile, this is where your logo and photo will show. So be sure to update that on your agent profile. When your client clicks Continue, your client's just going to see the exact same thing you saw. They'll be able to review all of their personal information is correct. Once they complete and look and review the information and acknowledge that it is correct, they will, I am the person enrolling. They will check the box and click Submit. Once your client clicks Submit, that enrollment goes directly to the carrier for processing. So to follow up on that enrollment, you will need to either call the carrier directly for status or access status through that carrier's portal. So for Aetna, you would do Producer World, United Healthcare, Jarvis, or WellCare, the Workbench, to get access to enrollment details after it has been submitted to the carrier. The carriers do not report back any information to the platform once it is submitted. Your client receives the application submitted, and you receive an email letting you know that the application was submitted. The client can just close out that page. We can then come back When in a phone call, you don't want to refresh the window. You want to just switch in between two different pages on the profile to refresh that profile page rather than click refresh. By clicking refresh, it will end the phone call. We can then confirm our client has enrolled in the Aetna Medicare Smart Fit plan. We can view a PDF of that completed enrollment form. And it also tells us we have 2 days left to complete that HRA. By clicking on more details, we get access to that HRA button. Once you click on the complete HRA, it will direct you to the external site to complete that. Again, in 2024, it tells us how many days we have left to complete the HRA. I do want to remind everyone that each carrier treats the HRAs differently. To find out the HRA for each different carrier, we can come in and look at the 2024 MyHealthPlan HRA. Now for Aetna, it's a link out, meaning you need to meet with them face-to-face in order to complete that enrollment. Anthem is built in. You can do any type of enrollment and you have 7 days. So definitely look up whether or not you need to be meeting with them in face-to-face to complete the HRA, or especially for the WellCare, Humana, Geisinger, Centene, and Aetna. They require you to meet face-to-face. But you can complete that right here on the agent's profile, on the client's profile. Over here, at this time, the reassigned agent of record is not yet active. Once that is active, we will give you more information on that. Also over here on the right, we can see a scope of appointment was completed on this profile. It automatically created notes when the application was sent and a call recording was initialized. And any tasks that we have on this client are also listed over here on the right. As soon as we try to leave this client's profile, we do see that it will end that call. So we're going to go ahead and end that call recording. Another feature of my health plan is right up here at the top. Next to dashboard, we have the plans button. The plans button allows us to simply just go in quick, enter in a zip code, and shop for plans without that plan being tied to a client profile. So once we create a client profile and we're in that profile and go to the plans page, we can always see that client's name right here in the top right. We have your agent name with a drop-down arrow. And then when we're in a profile, we can see that client's name with a little drop-down arrow below the agent name. When using the plans button and searching for plans, again, it's not tied to a client profile. It's really just a very convenient way to be able to come in and see what plans are available in a zip code, hop into a certain plan's details, jump down and get their summary of benefits or evidence of coverage, or an enrollment application if it's provided by that carrier. We can always go back to our plans by clicking previous. And again, when we click on plans here at the top and do this search, it's just a really quick way for us to be able to pop in and see plans available in a specific zip code and gain access to those plan documents that are being held in the plan details of each of these carriers' plans. If you're not looking to necessarily create a profile for your client, but would like to look at plans in a certain area, definitely utilize My Health Plan and list plans button at the top. Once you're able to identify a plan for your client, you can always come in here and create a new profile to go back to tie that plan to your client's profile. On our dashboard page, we can now see that we have the scope of appointment. We've followed up on all of our tasks. Again, if you have any questions, you can refer here to the agent training materials, or you can reach out to us here at JSA at 800-203-0433. You can also reach us at info@jsaonline.com. Again, if you have any questions or need any carriers added to your platform, please reach out to us here at JSA at 1-800-203-0433. Again, my name is Eric Pearson. I work in agent relations here in our Fort Myers, Florida office.